Well, it's about 2 weeks after surgery now. And I figured I'd make a video to kind of follow up with the past video of me in the hospital. And this is an appropriate time to do it. It's a nice day out, and I figured, what the heck. So basically, when I got home from the hospital, I was in a lot of pain, as you could imagine. The pain was pretty bad. But it was managed well. I have been on hydrocodone essentially nonstop, and I am still on it. But I've also tapered down quite a bit. I used to take 2 pills of the hydros every 4 hours, and now I'm like 1.5 every 6 or something like that. So my pain has been getting better, but it's still there. But I'm absolutely amazed at how I'm able to get around and, well, quite frankly, be on my own, really. I've been able to get up and down stairs, get out of bed, get dressed, use the bathroom, take a shower, all that stuff, pretty much on my own. So 2 weeks post-op, it's pretty damn impressive, especially considering the extent of the surgery. I mean, I don't like to brag, but this really is one of the most intense surgeries you can get. My entire center of gravity was shifted. It's like a lot of people who get spinal fusions like this have to relearn how to walk. But mine is perfect. My center of gravity is right where it should be. So to me, walking was actually easier. So, huge ass B. What I would basically been doing is just hanging out and sitting down. I bought a new chair, which to me was important because I had, to be sitting down at the computer so much. That to me was a good investment. I think you'll find that what I would ask myself, well, what the hardest thing was. Well, the hardest thing, honestly, is probably just adjusting to your new body. Getting dressed is very hard. You don't want to strain anything, but you can't bend, lift, or twist for 6 to 8 weeks. So you have to be very creative. Things such as, getting dressed are difficult. You have to kind of be creative about it. Your body doesn't really know how to move. Another thing that's really difficult, at least for me in the beginning, was getting used to my new height. I grew about 2 inches in height, and my entire body is different. My entire chest is bigger. It's opened up, and when I sat down for the first time on a couch, I literally couldn't get up. I really couldn't move, and it was like a scene from some sort of nursing home comedy. But luckily, my mother had helped me up, and I had since then relearned how to use my legs, and I can get up from everything now, which is really good, obviously. But originally it was pretty difficult to get up. I really couldn't get up. I think that was the hardest thing besides the flexibility issue was sitting down and getting up, because you want to be in a restful position. I can sit now for hours and not be in pain, which is amazing, but I also was quite taken back by the fact that I couldn't really get up easily. So now that I've been, I've had experience with that, it's a little bit easier. Another side effect that nobody will really mention, but it's absolutely severe in my case, was constipation. And actually, more specifically, abdominal pain, which was just unbelievable. In fact, in the hospital, I think I had worse abdominal pain than my back pain. In fact, now that I'm talking to you about it, I don't really think my back pain was an issue. I took the medications for abdominal pain, which actually was causing it. The narcotics were causing the pain in my stomach. And mind you, I was not on any Tylenol. Okay, they put me on methadone, and then they also put me on Dilaudid, which is like hydromorphone, very powerful opiate drugs. But they're notorious for causing constipation, and that was a big thing. In fact, they won't even feed you until you have bowel sounds, and I just remember thinking God, I hope I'm working. I was kind of nervous, but everything ended up being fine, so that's good. But that's not unheard of to have really bad abdominal pains. Plus, you're laying down for, in some cases, 36, 48 hours, and your surgery the physics of it is going right to your stomach. So your whole abdominal area is being just in shock. I mean, it's what's going on? But it's very important that they feed you, and they make sure that you eat before you leave, and you have to, have a working system. They won't let you leave without it. But very uncomfortable, very common, though. So, aside from that, I've just been playing a lot of guitar and a lot of music. As you can probably tell from my other videos on here, I'm a huge music geek, and that was probably one of my biggest concerns was, will I be able to play my instruments while I'm recovering? And my doctor said, yeah, absolutely. Just it might be a little painful in the beginning, but it's not going to hurt you. And really, it's not painful at all. I can sit fine. I have, just like, 15, just a lot of guitars, and each one of them is a little more comfortable. The ones I really have not played yet are the heavier ones for obvious reasons. I really don't want to hurt myself. I can't lift, so my personal limit is like 5-10 pounds. I really shouldn't lift more than that. So, but that's perfectly fine. Yeah, basically that's really it. I'm really healing well. I'm very glad I had this done now. It's a beautiful day out, like I said earlier, and I feel pretty good. Now, I am drugged right now, but I feel pretty good. I don't think that this is anywhere near the ease of recovery that I expected. I really thought I was going to be in bed for like a month. So I guess I'm pretty fortunate. And I also had an incredible surgeon in a very nice hospital. And my parents have really been like awesome for me. So I think that while I would recommend it, I would say that this is not for everybody. And also it's not something that, I wouldn't say any doctor can do this. I would say I definitely searched out for the best of the best. I made sure I was comfortable with my doctor. I made sure everything was aligned with this. And quite frankly, I put off surgery for the better part of almost 10 years. So when I finally decided to have surgery, it was a huge decision. And as you can imagine, there's a lot of anxiety attached to that. But it worked out in the end, so I'm very happy. And I can feel my legs, and I have no neurological problems. Aside from the fact that I can't feel my back, which the nerves will grow back, but I'm really not anywhere anxious for those nerves to grow back. I'm enjoying the numb feeling in my spine right now, so. But no other problems. As a completely unrelated side note, I have been doing a lot of reading, and a little bit shout out to my American Idol friends. I've also been reading Cara DioGuardi's book, which is a great book in my opinion, but it really caught me off guard because she swears like a drunken sailor throughout the entire book, which is kind of amusing to me and maybe to you. And there's some very good stories in here, very interesting stories, and I would actually recommend it even for people who have no idea who the hell she even is. It's a good book, and I find it entertaining. Also, I've been drinking a lot of liquids, just to help me with everything. Liquids are good. A lot of Gatorade and stuff like that. But also, recently, I've been getting back into caffeine. In this case, Pepsi. And funny story about caffeine, actually. Caffeine is a astringent, meaning that it constricts blood vessels, basically. In fact, it does have a medical use, believe it or not. Drugs like Excedrin actually contain caffeine. And it was very well known in the ancient days that the bean of the coffee plant was actually helpful for surgery, believe it or not, because of this. And the effect was so powerful, they would give it to people. I am a huge caffeine junkie. Of course, right now you think I'm just a junkie in general, but I love caffeine. I would have like 6 cups of coffee a day. And then when I went to surgery, of course, I had none. So I had a wicked headache, and I could only blame caffeine for that. Even through all the medications for pain, I still had a headache. So when I first had caffeine after surgery, it went away. And I knew that was why. But the funny part is that it hit me so hard. Like, I hadn't had caffeine in like a week, and that was probably the first time I didn't go with drinking caffeine for like 10 years. 8 years, 10 years. And it seems to me that when I'm on these medications, maybe it's by the way, I'm on Lyrica, hydrocodone, and then all the stuff for my, like Senna and Colace for the abdominal stuff. But anyway, so it was very powerful. It was like potentiated almost from that stuff. And it was a very weird feeling. But it also kept my bowels moving. So perhaps there's some value in drinking caffeine while you're healing. Which, by the way, I asked the doctor and they said that's fine. So before you start yelling at me for drinking caffeine, it's actually okay. So who knows? If you don't drink caffeine and you're having the surgery and you feel that you don't feel right, maybe it's that. Think about it. It's a drug, Anyway, that's pretty much my life. Be cool, be safe, don't do anything I wouldn't do, and from my end to yours, I say that so far I'm very happy I had this done. It's obviously going to be a very long process. I don't work for 3 months, which, is good. But then again, I kind of go crazy a little bit. So, seems to be going well. Thanks for watching, and I'll be sure to have an update shortly following even more progress. So, thanks for watching and take care. No, I'm not paid by Pepsi. Don't ask.